Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Michiel Rauws. He is the CEO of X2AI, which I usually always mess up, but I did it great that time. So what you guys have, your startup company, we spoke a couple years ago, and you were one of the first chatbot companies I had ever talked to. And so what is new? You have a chatbot startup where your robot basically delivers like mental health coaching.
Yeah.
Tell me more, because it has been a long time since we chatted. So initially it was text message delivery. She provided basically helpful tips and advice and a person to talk to. Her name is Tess. I remember that. Give me the update, Michiel. What's going on?
Yeah, so quite a lot has changed. So
Okay.
we started with simple conversations, because it all started with actually me running into issues in the mental health system.
Okay, and when was this? Give everybody a context here.
Yeah,
What year?
So that was back in, I think 2012, something like
which
that.
is in health tech a long time.
Yes. Yeah, we were early, very early.
Very early.
Yeah, so we really focused there, and it was just during my own treatment, I actually realized that it was hard to reach the doctor in between sessions and during the wait line. And that was actually in Europe, where conditions are pretty good. So compared to here in the US, it's often way longer that patients have to wait. So we wanted to start out and fix that. And while we were working on that, I actually realized I was often talking to coworkers and family, and I was just repeating the same conversations I had with my therapist, but this time I was sort of acting like the coach or the supportive friend. And once I realized hey, that's helping people, we figured out how we could translate that into the chatbot and have conversations that actually support people and make people feel better.
And I remember seeing your technology at Exponential Medicine at that conference. You guys won the Medi Award there, which is like a startup award. And it was because your tech was really slick at the time. This was 2015 or 16. And it was oh my God, chatbots. It was that was the new thing.
Yeah.
So that technology in healthcare has become kind of ubiquitous now. There's a lot of people using it in a lot of different ways. So what are you guys doing now? How have you evolved? What's happening with the robot part of the technology?
Yeah. So really since ELISA, which was a project back in the 60s at MIT, we were the first one to come up with, hey, we want to use this for mental health again. And so initially the conversations were limited. So over the years we've added more conversations. Plus the biggest thing is really the research that we did. So we now have about 5 published research studies, another 7 manuscripts, and another 10 ongoing research studies.
And what are you studying? Give us a sense of what you guys are looking at, can you?
Yeah, my favorite studies are the ones about the efficacy of Tess.
Okay.
So are these conversations of chatting with Tess helping people, making them feel better?
What are you finding out?
So we actually see that symptoms go down. So we see symptom remission for depression and anxiety by 13 to 18% over 2 weeks.
Okay, so what kinds of symptoms are going down? Like you said, for depression and anxiety. So what are some of the symptoms that are abating that you've measured?
Yeah, so if someone is very stressed at work and they can't properly do their job, then they can help by chatting with Tess.
Okay.
And that's what we're now doing on a large scale with employers as well. There's about 4 million people who have paid access to the service. So that's mainly an employer market that we work with employee assistance programs to give very large groups of employees access to our service.
Okay.
So at 24/7, any time of the day, if they feel bad, they just text and they get access. They just start chatting. And it might turn out that they need to talk to a person. That's totally fine. Then Tess just does the triage and refers them to a counselor, and then also sends a brief summary to the counselor so that the counselor knows what it's going to be about.
That's good for the patient as well then, because the person doesn't have to repeat themselves over and over. It's streamless, perfect. Okay, so let me ask you a question. So, I understand your system, the way you guys have designed it, it goes back and forth, or it can go back and forth between a robot and a real person providing coaching. So, does the person on the other side of that, the patient, so to speak, do they know that it's transitioning, or is it seamless to them? They think it's one test that they're talking to, not multiple personality tests.
Yeah, it's very seamless, but it doesn't mean that we don't tell them.
Oh,
we definitely tell them. We're very transparent. So at the start, we tell them, you start with talking to Tess, and once they switch to a person, we tell them.
Okay.
And also, right now, we also have it available on Amazon Alexa and Google Home.
Okay.
So if people switch from texting then to talk on Google Home, then sometimes that becomes more blurred because they're oh, now someone is speaking. This seems really like a human now. So then sometimes we have to reiterate, by the way,
this
just
is
to
not
remind
a person.
you. Yeah. And that's important because it makes people feel safe and open up more. It actually people have shown, like in studies they found, that they feel more safe, that they open up more and talk more about their feelings if they know it's more anonymous and if they know they're talking to a robot.
Okay.
Yeah.
So they are actually more open and more honest with the robot than they are with the real person.
Yeah.
Because they just don't. I would imagine like you don't feel like you're judged or whatever, right?
And that's the really exciting thing, because often when we talk to clinicians, because we are always the partner to the provider, the partner to the healthcare system, the partner to the payer. And often the clinical director says like, yes, but you can never replace the bond between the therapist and the patient. And we say, no, that's not what we do.
Right.
We're just yet another channel to reach the patient, and especially we reach them at scale. So especially all the patients who never had access to talk to a person, to talk to a coach or a therapist, that we can suddenly reach them and really be proactive and reach out. Because the healthcare system often in the past years and decades has always been reactive, but we want to be proactive. So next to like taking calls from call centers and routing them through Tess, we can also be proactive and reach out to people and get them into the healthcare system to prevent their symptoms from getting worse.
And that same vein, I'm very curious like about this idea of people being much more honest with the robot. Like I'm really curious about that. And like actually what you said about like care providers and them, being a little bit concerned, like, oh no, the relationship with the therapist. And I'm curious, like as you're looking at your own clientele, even anecdotally, are you finding like, does it actually, what you said about them trusting the robot more, does it make them more ready to have a better relationship with the therapist? Because of, like, you know what I'm saying?
Yeah,
like
you're selling this better than I do.
No, I'm just curious.
no, that's true.
Okay.
So we actually found in one of our randomized controlled trials with Northwestern University that we used the therapeutic bond scale, because we always heard about this therapeutic bond. So we're like, let's use like the therapeutic bond scale. So one of the items looks into like how willing is someone to open up. And that's one of the things it scored on very well, that after chatting with Tess, suddenly that improved. So suddenly, because they got used to talking about their feelings with Tess, they suddenly were more used to talking about their feelings with the therapist.
Oh my God, see? Okay, no. And the reason I asked that, because it's like, this is like a bigger issue, I think, in our industry with technology and health. Because, like traditional technology, right? It's like, it's not a life or death thing, but when you layer in the health, it becomes that. Yeah. And so it's a little bit, people are nervous about it. And it's like, you've seen other parts of healthcare where, like, for example, like with radiology and like being able, like, for a machine now to read scans and find tumors. And there was all this like fuss about, the radiologists are going to be displaced. And it's like, any of the companies that have that technology are like, no, not going to displace, but we're helping the radiologists do a better job. Yeah. And so it's almost like the same thing here with the chatbots, right?
Yeah, especially like we're helping them have more access to health. And it could be that Tess might misunderstand a message here or there, but then it's just going to look like a weird conversation. And someone might just say like, I don't know what you mean. Yeah. And then Tess will reorient and get back on track. Okay. So it's never horrible if something like that happens, because it's simply learning and people like it. Like we change the responses in a way that Tess simply says, well, I'm still learning as well, and then they get reminded again like, this is not a person. And then we also said like, if you want to talk to a person, here's the phone number, or if you want to talk to a person, let me know. Within 1 minute a person will take over this conversation.
No, that's amazing. It's so exciting to hear how your business has grown. Last thing for you, I do want you to talk about the business. So X2AI as a company, where are you guys at right now? Are you raising money? Are you like between rounds? Like I have no idea. Give me an update.
Yeah. Luckily, we're just very much focused on our customers and clients, and we've been just expanding a lot. Okay. And we've been at many industry organizations really just to educate, because it's still very new for everyone. So we're really there. We're getting keynotes, but also 2-hour workshops. And we're there just to explain like, hey, this is not something super scary. It's very easy to implement as well. It can be implemented literally the next day. Yeah. And that's really what we focus on. And now we have customers here in the United States, but also in Canada and in Europe. And we have resellers in Australia. Japan is going to get added on, and China.
That'll be interesting with the language and the cultural differences there.
Yeah, so luckily we've already done that when translating it to Arabic and to Spanish. Okay. So especially for
you're like a pro at this now?
Yeah, we're getting used to it.
Is your name still Tess when you go over there?
There's many different names as well. So some of our resellers, for example in Canada, St. Elizabeth Healthcare, they call their version ELISbot. Nice. And that's their version. They they use our administration panel to completely customize all the conversations, to write their own conversations. And that's completely their product, basically, but our technology. Yeah.
Awesome.
And it's on Facebook. Anyone can try it out. Right now, it's still for free. So I know they're in the future going to charge for it, but now it's still for free. So Elist bot on Facebook, you can go and try it out.
All right, very cool. Michael, thank you so much for joining me. It's a pleasure to catch up with you. Thank you so much. It sounds like you're doing amazing things. All right, I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.